So let's start with sex education. Most couples sitting in your office have not received accurate sexual health education. And this really is your role as their sex therapist, as their therapist treating their sexual health issues, to give them the most relevant sexual health information that's going to help them reach their treatment goals. One of the most important pieces to really explain that spontaneous versus responsive desire, which we talked about just a little bit earlier. And when you're explaining that, really normalize the responsive desire to the couple. Because if you think about the messages from media and society, most of the messages are about spontaneous desire. You should just want sex. You should just passionately want sex. You should immediately want it. It should be spontaneous. There's so many messages that's what's normal. And if you don't have that, then something's wrong with you. But that is not accurate. That is not what we see in the research literature. It is quite normal for your main desire to be responsive desire. So really normalize for couples that it is not that spontaneous desire is better than responsive. It is simply that they are different. These are different types of desire, and one is not better than the other. There can often be this narrative between couples, and you can see some of this narrative with Kelly and James, that Kelly is broken. There's something wrong with her. She even says she feels like she's broken. So being really clear with the couple, she is not broken, is that her desire is a different type of desire as James, and one is not better than the other. One is not right or wrong. So you've given them some good, accurate sexual health information, especially around these two different types of desire. And then you're going to share with them that dual control model, the brake pedal, gas pedal, talking about how so many different factors can hit the brake. So many different factors can hit the gas. These factors fall under that biopsychosocial model, which we talked about a little bit earlier. So you've given them this really good, accurate sexual health information about the types of desire and the brake pedal, gas pedal. These two different types of sexual desire are also different ways that people sexually respond. Like I mentioned before, for some people, it's desire first and then arousal. And for some people, it's arousal first and then desire. If you want to show this to your clients pictorially, more with a visual, which sometimes can land better with clients when they can visually see it, I'll use something called the linear model and the circular model. So this is the linear model. And the linear model, this is the term for basically that spontaneous desire. And here's what the linear model looks like. It starts with desire at the bottom. And again, spontaneous desire starts with desire. And then as you move up, it goes to arousal. So you have desire, I want to have sex, your body goes to arousal. Then that leads to orgasm, and then what's called the resolution phase. That resolution phase, I just say to clients, it's cuddle time. So orgasm, in this particular model, this isn't totally relevant, just a little side note, but if you're wondering, why are there 3 lines on here? Because those 3 lines represent the 3 different types of orgasm. For some people, it's one big orgasm. For other people, it's multiple big orgasms. For some people, it's one long little orgasm. But essentially, what's relevant in this model is this linear model is the spontaneous desire model. It starts with desire and then goes to arousal and then orgasm. This is much different than the responsive desire model. The responsive desire model is also called in the literature the circular model. And this one looks a lot more complicated. So let me walk you through it. Now, in that upper right-hand corner, it says seeking out and being receptive to. So this is how that model starts, that the person is receptive to being sexual, that all those right ingredients are in place. So they say, okay, like I'm open to being sexual. Then as you follow the circle of this model, so they say I'm receptive to being sexual. Next, there needs to be some sort of sexual stimuli. That may be your partner initiating sex. That might be like a sexy show on television or a sexy book on your nightstand that you pick up. So it doesn't have to be a partner initiating, but there's some sort of sexual stimuli. Now, as we're following the circle, as long as biologically and psychologically everything's in check. Biologically, you don't have a massive headache in that moment. You're not feeling ill. Psychologically, you aren't stressed out. You're not depressed. Mental health feels pretty well managed. The next thing that's going to happen is your body gets aroused. That's where arousal comes first. Arousal comes first. And then on the coattails of that arousal is the desire. Okay, this is a huge difference between that linear model and the circular model. And the circular model, arousal first, then desire. This is where the person says, oh yeah, I'm glad we're doing this. Now then that leads to some sort of emotional and physical satisfaction. Satisfaction might be orgasm, but it might be something totally different. It might just be the satisfaction of the skin-to-skin contact, feeling connected to your partner. But there's some sort of emotional and physical satisfaction. Then that leads to feeling emotional intimacy, feeling connected to your partner, which then leads you to either seek out or be receptive toward sexual activity in the future. That's the circular model. So if your main desire is that responsive desire, this is the model you follow. And if any one of these pieces are missing, then it's going to be really difficult to be responsive. So for example, if your body's not getting aroused, it's going to be really difficult to get responsive. If you don't feel emotionally close to your partner, it's going to be really difficult to be responsive. Just because your main desire is responsive desire, that doesn't mean you never have spontaneous desire. A lot of women report, and Kelly has mentioned this too, that they'll experience spontaneous desire like at certain parts of their menstrual cycle, like maybe the week after their period has ended. So with this piece, you can have your main desire be responsive, and you can still sometimes get spontaneous desire. So if you look back in this picture, spontaneous desire is in the middle of the circle, and you see a few arrows coming out of it. If you have spontaneous desire, maybe that leads you to just seek out sexual stimuli. You're seeking it out. Maybe that leads you to just be aroused in that moment. But it's a much quicker way. Spontaneous desire is a much quicker way to kickstart everything, to jump into this cycle. So those are the two different types of sexual desire. Spontaneous, which is represented with that linear model, and responsive, which is represented with that circular model. Now, when it comes to sex education, you as a therapist, psychologist, you may not have a ton of sex education because certainly most graduate programs do not teach sex therapy or sex education psychology course. So if you're wanting to learn more about sexual health and share more resources to your clients, a couple suggestions or recommendations. One of the most comprehensive sex education books, which is everything you wanted to know and maybe everything you didn't want to know about sexual health, is called The Guide to Getting It On by Paul Joannides. Pretty thick book, but I'll recommend that couples purchase that book and read a chapter a week together, and to read every chapter. Even if there are chapters they don't want to know anything about, like maybe there's a chapter on anal sex that I have no interest in hearing about, I still recommend they read it. Because if they're talking about how much they hate that chapter, great. That means they're talking about sex. So that really helps with couples who don't have the best sexual communication, like Kelly and James. Another great book, I would say hands down the best book I've ever read on women's sexual health, is called Come As You Are by Emily Nagoski, and it has an accompanying workbook as well. Even though the book is focused toward women's sexual health, it really is relevant to sexual health of all genders. And so I'll recommend couples get that book, get the accompanying workbook, and start reading through it together and completing the workbook together. And those two resources alone will really help your couples have the bibliotherapy that they need when it comes to learning accurate sexual health information.